Good morning. Good morning. It is a pleasure for us to be here today. We are thrilled. My name is Cindy Samuelson. I work with the Kansas Hospital Association. And like you, a few years ago, we celebrated our 100th anniversary in 1910. So we have been around a long time, a little bit longer than you guys, but congratulations on your 100 years. That's quite an accomplishment. We are an organization that represents 127 community hospitals across the state of Kansas. Thrilled to be here in Neodesha today to present this award to you. Our vision is optimal health for all Kansans, and the work you're doing here is a tie to that mission and vision of the Kansas Hospital Association. I am thrilled this morning to introduce a very important part of our staff, which is our CEO of our foundation. We have the Kansas Hospital Education and Research Foundation that was established in 1969. Today with us is Melissa Hungerford, who is our current CEO and has actually been with KHA 38 years. So she has a lot of great history as well. So with no other hesitation, let me introduce Melissa Hungerford.
Pleasure, and I'm kind of impressed that Cindy didn't say I was there when the association started. I was not. KHERF, which is what we call our foundation, started the Healthy Kansas Hospitals project in July of 2013, thanks to a grant from the Kansas Health Foundation. The project, Healthy Kansas Hospitals, is a collaborative approach to work with hospitals and their communities to help lead the way to choose healthy food and beverage options. But more importantly, in this past year, we've really expanded outside the walls of the hospital, and most of our awardees this year have really shown how to break outside the hospital walls and help their community. We have worked through this project with an advisory group that represents hospitals all over the state. They've helped to provide and create materials that many hospitals have used, like ones that Neodesha has put in place here. And let me recognize Haley Finch-Gorshek, but Haley has been our lead staff, so thank you, Haley, for all the great work you've done. We think this activity is truly important. It impacts not only the patients in the hospital, but the employees, the medical staff, the clinic staff, and then finally the families and general public that is served by the hospital. The work, as Cindy said, is inherent in our mission to prevent and treat chronic disease. Hospitals have the potential to serve as a powerful role model in their communities by offering healthy foods choices and educating communities on the kinds of choices that they can make. As of today, 81 hospitals have signed a pledge to follow leaders like Neodesha and Wilson Medical Center. 33 have formally adopted policies, and our second Healthy Kansas Hospital Summit brought 100 folks together to really look at successes and where their common challenges were and how to address those challenges. So congratulations to Wilson Medical Center on their changes. Thanks to the commitment of the Wellness Committee, and I bet there are a few Wellness Committee members here in the audience today. Raise your hand if you're on the Wellness Committee. Yeah, you guys have done some great work, but thanks to their work, the board and medical staff have approved new policies and strategies to focus on improving the dietary choices within the hospital and increasing opportunities for exercise that the employees can take advantage of them. Great progress since 2015 when you all started. The Healthy Kansas Hospital philosophy has here extended beyond the hospital walls and working with the County Health Department and USD 467 to bring Fitness is Fun to the after-school program. That's really an awesome strategy that you all have implemented. As major employers in the community and a significant source of health care for Wilson County Medical Center has taken the opportunity to establish strong community norms and influence the health decisions of the public. So with that, to talk more about the accomplishments that they've had, let me introduce Dennis Shelby, CEO of Wilson County Medical Center. Congratulations.
Thanks, Melissa. It truly is an honor to be recognized today. And I want the most important thing I can share is it takes a lot of folks to make something like this happen. So I am going to announce, share who is on our original wellness committee and then the additions since then. So the original committee, Dr. Cunningham, Brooke Baird, Jill Wallace, Tracy Walker, Director of Dietary Services, Heather Odell, Director of Rehabilitation Services, Laura Dean, our HR Director, Janice Reese, and myself. Those were the original champions of the program. And in the last several months, we've expanded that to include community members. And we have George Cagle from Cobalt. We have Kelly Bradford, who's one of our, works at Fort County Mental Health, but also does some consulting here. Ed Trula from the city. He's our head of the city. And then Mary Bauman from the school district, Melissa Johnson, as well as Karen Porter. Julie Nickel from our staff is there. Valen Jones, who's helping with grants. And Erica Johnson, who is the director of our wellness initiative. We decided to get very much into that, and that is a focus. Southeast Kansas has some of the worst health as a whole group in the state. And they heard me say this. My goal as CEO is we've got to bend that curve. We've got to bend that curve from the deal with obesity, smoking, exercise. We have got to implement those things to bend that curve and change the health status of Southeast Kansas. So, like I said, it takes a lot of folks to make this happen. So, if I mentioned your name already, I would like you all, those of you whose name has been mentioned, I'd like you to stand up. And Bobby, you're welcome to stand up on behalf of Ed. I don't think Ed's here, so if you all stand up the ones I mentioned. And then also our board of trustees that are here. We got Chad and Drew, if you guys will stand up, because they have to approve all these policies that we put into play. And if Todd Durham from the county, as well as Cassie Edison, if you all could stand up, that would be great. So these are the folks here, so if you could give them all a great big hand. Melissa shared some global things that we've done, and I'm going to provide a little more specificity. Say that fast 5 times. So we started this whole thing with the removal of sugary drinks. That was where we started. And when I went around and talked to the different Do It meetings, which stands for Daily Ongoing Improvement Tactics, the interesting thing I found is they said, hey, we're hearing just as bad things about diet beverages as sugary beverages. So they just said, why don't you just eliminate both? That wasn't my idea, except for my wife. She was the only holdout. So they went above and beyond, and we've done that. It's been a couple of years now, and it's working great. We also, the Get Fit, our exercise and fitness program, organized a marathon walking club, and there were 29 of our employees that participated over a 5-month period, and it was 1,695 miles that group ran. So there were 19 of those 29 that actually completed a marathon, if you will, or more in their walking. So that was pretty incredible. We have done a national national walk at lunch day. We have also implemented all the policies for our dietary, catering events. So That's been done. Our nutritional department provided an assessment of snacks and eliminated sugary snacks out of our vending in here and gave more options for fruits, healthier items. We provided water infusion bottles for all of our employees. Some other things that we have started is Brooke Baird started what's called the Ideal Protein Weight Loss Program, and we provide that service to the community, but our employees receive the service at cost. So that's been a good program for us. Then our Get Fit went through a remodel. We were growing, our rehab was growing, our exercise was growing, and did a remodel that our foundation paid for. And got some new equipment, and then we went 24/7. We have, you can a fob, and you can get in 24/7. And so that's been an outstanding program, and we provide that also to our employees that are interested at no cost and a discount for their families. And Janice and myself work closely with the county and also for Fredonia Regional Medical Center to partner on the improvement of health in Wilson County, and that continues to this day. So they would be considered a partner. We also have promoted the KU Extension Walk Kansas program, and we had 5 teams that participated in that. We have a Healthy Kids Day, and some of you may have driven by our little walking trail out here. And we bring in kids, 2nd graders through 5th graders from Neodesha schools and Altoona. And that's been a very successful program. Sustainability, I mean, all this stuff is good, but if we don't keep doing it, then it's really not going to accomplish what needs to be accomplished down here in southeast Kansas. So we will continue to do the following. We'll continue to have wellness fairs for our employees. We will continue to provide free memberships and discounted membership for employees' families. We'll continue to promote and host walking, run events throughout the community. We'll continue to work with the County Health Department and Fredonia Regional on wellness and health initiatives. We'll continue to provide sports physicals for the area schools, which is going on right now. We'll continue to grow our diabetes and nutritional center services. And we will also collaborate with the county and others on healthcare initiatives throughout Wilson County. The thing that most people forget about it is being involved in the political arena. We will commit to working locally, regionally, statewide, and federally with our representatives to have an impact on health initiatives. Some additional things that have happened since we submitted our application is that under Erica's leadership, we are working with restaurants in the area to provide healthy menu options. We will be, with our diabetes education program, going into our local grocery stores in the areas where we have entities and provide tours with our diabetic members and their loved ones to show the right kinds of things where they should be shopping in the grocery store. They usually say around the outer edge of the store. And also teach them about the nutritional labels A lot of those are very confusing if you've ever looked at them. And I know I ate a whole box of Cheez-Its and I thought that was a serving size, but it's like there's 20 servings in there, so that was not good. And I've done that a time or two or three. The other thing is we'll continue the community health education, which I mentioned. And we are, in June, we're starting a I'll call it a minimally non-surgical and minimally invasive non-surgical weight loss procedure to help people that are in that pre-diabetic state to not become diabetic. And then a year from now, we will have a pre-diabetic program. We have to have a 1-year track record of doing the program, and then Medicare will actually pay for that. They do not pay for pre-diabetic counseling, which doesn't make sense, but they're getting with the program, and so we'll be starting that. Seeing Judy here, we've also already started a chronic care management program where we call, where she calls patients in our clinics to make sure if they have 2 or more chronic diseases that they're managed effectively. And that program is going well. We have 96 people signed up on that, and it's being very well received. So, and one last thing is this was something our board, we talked about at our strategic planning retreat. They're maybe hearing this for the first time as well, but we've been interviewing for an athletic trainer. That's a service that is not available here. It's going to be a community service for us, and we're going to provide athletic training services to the local high schools. And that we're talking Neosho, Fredonia, Cherryvale, Independence, and if we most likely Altoona as well. So we interviewed and we found somebody that's going to do a great job for us. We just extended an offer, I think, last week, and she's accepted. So we're going to do what we can to help in that area. And she'll do lots of other things, not just the athletic training, but she'll be involved in other health initiatives. So that's a lot that has been done by all of you that are here. And I'm very proud of the efforts that the group has made. And Janice has even been working on the Healthy Hospital Task Force at the state level. So appreciate all that effort there.
You might have noticed we have some very healthy and yummy foods laid out front that we are ready to partake in a few little things. Questions? Are there any questions for Dennis or Melissa or any of the staff about what you guys are doing here at the hospital? Any questions at all? You guys really covered a lot of things. Lots of things. And we want to help you continue to do a lot of things with these programs, and that's one of the reasons for the Centers of Excellence Award. And so if you would come up, Dennis, and whatever folks you want to have join you, we have a check for $1,000 to present to Wilson Medical Center to help continue that program. So Melissa, come up here and we'll get you guys presenting this check.
I'm accepting this on behalf of the Wellness Committee to feel more comfortable staying where they are.
Dennis, you can't too fast and bake.
What's that?
Can't go
Oh, I can't?
You have to drive it
Yeah,
up.
that drive-through window.
You gotta take it in.
So I'll take this. Oh, sorry. Okay, and I'll take this one and give Melissa this one to present to you for the drive-through.
Thank you.